Hello everyone, my name is Joras Bureau. I will be presenting today about the uneasy path that immigrants had to take to be able to come to Canada. I think that this is a timely subject because of the increased scrutiny that are being directed to immigrants today. As nurses, I think it is important for us to understand the immigration history of our patients, given that we live in a multicultural country. This is so that we can create and establish an effective and culturally competent care. The main objectives of this presentation are for us nurses to have a knowledge about the immigration history and policies and the struggles that faces immigrants as well as their contribution to our country. Second is to promote cultural knowledge about immigrants immigration history in order to better establish a nurse-patient relationship and therapeutic care. More importantly, because of the expanding stigma about immigrants in our today's society, I think this issue calls for nurses to promote immigration knowledge and to help break this stigma, for it is essentially creating a negative impact on the overall health of immigrants, and as a result, it is putting a heavy strain to our healthcare system. Therefore, technically, every Canadian is affected. Let me touch on a little bit about Canada's immigration history. During the first census after Confederation, the British Isles were the main source of immigrants, which are about 83% of the population in the 1871 census, and a small fraction from United States, Germany, and France. Then, a second immigration boom following World War II continued significantly from Western Europe, which is Germany and Netherlands particularly, and the UK. And, and in the 1980s till the 1990s, Canada began to accept immigrants from Eastern Europe, primarily from Russia and Poland. While from the 1960s onwards, Canada admitted immigrants from Asia. According to Statistics Canada, immigration becomes the main driver of population growth in Canada. As we all know, and what we commonly hear, unless you are an Aboriginal or First Nations people, you are an immigrant. As you have just learned about immigration history, we are all immigrants. Here is the overview of Canada's immigration history that I talked about from the previous slide. This image on the slide depicts the influx of immigrants embarking at Liverpool for Quebec. It only shows that we are a country built of immigrants and built by immigrants. To reiterate again, unless you are an Aboriginal, you cannot deny that you are an immigrant. Okay, now what are the common reasons why people immigrate? In my own view, there are three main reasons why people choose to immigrate to Canada. Number one is because they're dreaming of a better life, for they do not have better opportunities back in their home country. Number two is to reunite with families who have already immigrated to Canada. And number three, which is unfortunate, is that they are running from their chaotic situation in their country, and therefore they seek for a better um, and safe refuge in Canada. Um, One example of this is where people run away from war, so they seek and apply for refugee status and asylum in Canada. However, as per Costigan, Ler, and Meow, their study in 2016 revealed that the top choices for immigration are: number one, to pursue their own education and employment and advancements; number two, for their own children's educational opportunities. So these are the parents who are dreaming of a better education and future for their children. Number three, spouses or parents and families have already immigrated in Canada. So they just come here and follow them because maybe because they're already just by themselves and all their family have already immigrated here. So uh, as a result, they tend to come here also. According to Immigration and Citizenship Canada, these are the ways these are the ways to immigrate in Canada. Number one is refugee and asylum. So these are the people who are running away from a bad situation, dangerous situation, or war. Um, Skilled worker, like for example, nurses, engineers, and doctors. Um, Provincial nominee. This is similar to the skilled worker program, but the difference is that they specifically come to Canada as nominated by the host provincial program. Um, the province determines the need and they skilled and require skilled workers and professionals, and they screen them professionals who meet and qualifies their expectation to fill the gap and helps maintain the economic growth in the province. Business, these are individuals who qualify to put up a business and create jobs in Canada. Then next is the family sponsorship program. Essentially, families who have immigrated and are permanent residents or have become Canadian citizens and are sponsoring their families to come to Canada. For example, I have a friend who came to Canada through the live-in caregiver program. Um, she lived in here as a nanny who has a contract. So basically, she's a contract worker. She applied for a permanent residency, and after her contract was finished, she seek for a different job where her employer, if she, when she had this stable job, she was able to prove to the government that she can support her family when they come here to Canada, and they got approved, and so they reunited. And the study program, this is gaining popularity nowadays. Um, in fact, I have a friend who is renting rooms to Filipino students who are studying at Canada and Nipissing. Basically, they are here for a determined number of years to study. And I found out on my interview with them that they are allowed to work 20 hours a week while studying, but 95% of them does not have a job. Then after their studies, the number of years that they study here in Canada, the Canadian government gives them that equivalent number of years to stay here to find a job, and they can apply for permanent residency only if there is an employer that would sponsor them. If not, their dream of staying in Canada remains a dream, and they will be sent home. Some of them actually spend millions of Philippine peso to come to Canada to study, and with the hope that they can eventually live here. I also would like to add that according to Statistics Canada, mostly admitted to Canada as an immigrant are under the economic and family class, um, with an increased proportion of females, and they mostly live in bigger cities, and they live with family members mostly. Okay, now that we have answered the questions why people immigrate, let us examine the driving force that encourage immigrants to come to a country like Canada. First, they dream of living a better life. From my personal knowledge, people who come to Canada as skilled workers, nannies, and others, they leave their kids, their families, their spouses back in their home country, to take care of other people here in Canada in order for them to provide a better life and future for their kids. To be able to come to Canada and work here needs money as well. There are people who tend to borrow money to pay for agencies who collect a hefty amount of fees for paper processing and other legalities and intricacies of um, the process. They are also at risk for being victimized by illegal recruiters, which remains the reality up to this day, and cost and lost everything with debts to pay. While coming here through the provincial nominee program, the truth is that they have to show that they can support themselves here. Some people that I know sold all their properties, borrowed money to prove to the government of Canada that they can support themselves when they get here. As you can see, they it takes courage to leave everything behind: families, friends, culture, country, just to be able to come here. According to Srivastava from the textbook The Guide to Clinical Cultural Competence, acculturation stress includes language, which are one of the struggles that the immigrants face, and that is what it takes to be able to stay here. That includes language. This is especially for those whose English is their second language. Um, I have experienced this myself. I was afraid that people might think that I was stupid or slow, but what was actually happening was that my brain translate the message first in my native language and then back to English. So it was very stressful. Usually, the employment and economic status of new immigrants are ego shattering. Sometimes it is because they do the menial jobs and low paying jobs due to the lack of language skills and education. In fact, even though I was educated back home with a degree and everything, I came here and found out that they do not acknowledge or recognize my education. So I had to go back to school, and essentially I was back to zero. I had to upgrade, and I went back to school to become a nurse because I know, even though with my education, I will not stand a chance to advance in my career here. Anyway, so from people that I know, during the first months, they cleaned houses. So did I. That is because of pride to be not a burden to the government and to contribute to the economy and send money to our families back home. Then, as for the family life, which I already discussed previously, most immigrants' families are back in their native countries, and even I can still not get used to it as the homesickness is real, really real. I also want to point out this image on the slide, um, which displays the fourth quality of the what it takes to immigrate, really, of an immigrant. Mm. So in this image, you can see our female overseas Filipino workers who are gathering and sharing their food, stories, culture. Um, they mostly gather during their days off just to be able to feel our home and get connected with their fellow Filipinos. It is also one of their ways to adapt and survive in a foreign country. On the next slide, you will see a video of an immigrant who came here through the skilled worker program. His family and him landed in Montreal, a French speaking city. He was a nurse back in the Philippines, and I asked him these three questions. What brought you to Canada? And what did it take for you to immigrate? And how do you feel about the misconceptions that you hear toward immigrants? I hope you can imagine how to immigrate and how difficult it was for this family to come and live here in Canada. JR and his family came to Canada through the skilled worker program, but despite his years of nursing experience, he cannot practice here as a nurse. So he is currently taking courses online so he can eventually practice as a nurse in Ontario. Although Canada has been greatly involved with the refugee and family reunification program as a humanitarian gesture, it actually comes last. First, in Canada's role or goal to immigration is directed and focused on economic gain. It ensures that the Canadian economy continues to thrive. So, the Canadian government devises programs to invite people to come to Canada. They primarily select individuals that would contribute to the Canadian economy and that would do well in Canada. Secondly, they help newcomers to reintegrate or integrate in the Canadian community through integration programs designed to help the different cultural and economical needs of newcomers. The dream of having a better life and to live in a safe country does not come without a price. The truth is that all immigrants experience called culture shock. Culture shock has three stages. Honeymoon stage is the first stage where everything you see and experience in a new country is exciting and positive. The second stage is the feeling and sense of dislocation and the general feeling of uneasiness. So you feel confused, angry, frustrated, you become withdrawn, and you develop negative feelings about the people and the culture in the host country. Adjustment is the last stage. It is where you act eventually start to adapt and accept the new environment. Another reality that immigrants face is acculturation stress. Acculturation stress involves language, employment, education, and family life. I'd like to focus on language because I have experienced this firsthand as I have been during the first few years of my stay in Canada. Immigrants are at risk of being labeled or as slow or stupid because of the language barrier. The next one is employment. Most immigrants before coming here are successful professionals like doctors, nurses, engineers, but when they come to Canada, their education is not recognized due to the standard disparities, and as a result, they struggle to find jobs that are in line with their professional attainment. It is ego breaking as they are forced to take menial jobs like cleaning houses and driving taxis. To start, just to be able to start and to survive and to provide for their families. That is the reality that is sometimes heartbreaking because they also lack support systems. The third one is racism. Racism is also a reality that we cannot ignore. According to Boyer, in his study in 2017, racism is the Canadian healthcare system in the Canadian healthcare system is endemic. While Srivastava stated that racism is an attitude as well as a specific action to which one group exercises power over others on the basis of skin color and racial heritage. I think we can all agree that this is happening every day. In fact, there are specific groups who are intentionally injecting or promoting hate in our society towards immigrants. Even the rhetoric of some powerful politicians contain racial discrimination. Lastly, stereotyping. Stereotyping is defined as the generalized conception of group of people which results in the conscious or unconscious categorization of a certain group without regard for individual differences. For instance, Muslim people are stereotyped as terrorists. Thus, this creates hate among affected individuals. As nurses, it is our duty to educate and examine ourselves so that we can provide a culturally competent care. We should also advocate for them because these realities in the life of immigrants affect their health. And since we are rich in diversity, then it is vital for nurses to have knowledge and awareness of what is happening in our society. Here I listed five struggles of immigrants. Number one is loneliness that leads to depression. Number two is generational conflict, which happens when the younger member of the family quickly adopts the host country's culture while the parents and other older member of the family dwells on the native culture, which results to challenging the pre-existing rules and norms within the family. Next is the struggle to fit in, especially for kids who tend to get bullied at school. Because of this, they isolate themselves and decreases their self-esteem over time. Number four is the overall life stresses attached to being an immigrant, which directly impacts physical and mental health. Number five is the immigrant women's health. I'd like to focus on this since this is the topic for this week's discussion. Generally, there are immigrants are in their superior health compared to the Canadian-born population when they first arrive here, but loses this advantage over time. Their health is determined by income, education, work, social support and stress, health practices, and use of services. The high social and better economic status and high family support and community support are associated to better health, and health practices change over time, assembling to those of the majority culture. In Ontario, study shows that new immigrants' usage of health services is lower compared to immigrants who have resided here for more than 10 years. Although the underutilization of preventative health and mental health services have been documented, and these are all attributed to a number of barriers, including the differences in cultural values, belief systems and practices, lack of access to culturally appropriate services, underrepresentation of immigrant and racial minority women in the healthcare profession and other major institutions, compromised mental health care due to stigmatization, racism, and general marginalization, geographic and financial factors. Stigma or hate. This image on the screen speaks for itself, which is truly hurtful and alarming. Some people incite hate and violence because of the differences in views and culture. I was reading a comment on Geographic Channel's post on Facebook where they are documenting the journey of migrants coming from El Salvador. Our lady, one lady commented that she works two jobs to be able to attend nursing school and that this migrant who is dreaming of going to the US and also dreaming to attend college should go back where she came from. Do you think she should be a nurse? I also ask you to examine yourself about your own beliefs and perceptions about immigrants. How do you really feel about them? Does your practice focuses on holistic care and not on culturally competent holistic care? Is it time to rethink your approach? There are also myths that immigrants are low skilled and difficult to integrate in the Canadian workforce. But the truth is, education attainment are higher among migrant population compared to Canadian born. School attendance is higher among migrant women compared to Canadian born. Senior immigrant women have larger share of income, although low income remains prevalent for immigrant women. Also, Canadian immigrants are highly educated, which puts Canada on top economically. Did you know that Canada's strong economic performance is attributed to strong influx of immigrants? And did you also know that immigrants contribute to the housing market resiliency? And by increasing the diversity of Canadian nursing workforce, promotes the provision of culturally competent care. Correspondingly, for nurses to provide a culturally competent care, they should build a knowledge about different cultures in order to understand the different practices and values among the Canadian population, which would enable them to therapeutically communicate and provide a culturally competent care. But before that, the nurse must first reflect on her own values and beliefs so that it would not interfere in establishing professional relationship with the patient. Then after reflecting on own values, it is important to know how to communicate cross-culturally. To accomplish the plan of care, it is essential for nurses to bridge the gap through the three modes of nursing actions and decisions, which includes culture care accommodation and negotiation, cultural care reframing and repatterning, and cultural care validation and preservation. Those are the transcultural nursing roles that leads to cultural competence. In my view, the main goal for this transcultural nursing course is for nurses to be ready to provide the culturally sensitive care to our patients. I have four recommendations that I believe nurses should incorporate in their own practice. Um, First, nurses should assess the immigration history of an individual through the therapeutic communication strategy. And they should also advocate and promote awareness on the plight of immigrants. They also must provide increased support to new immigrants by reaching out to them to promote preventative health care. And the main goal for this presentation is so that nurses can help promote awareness and break stigma in the increasing immigrant society. So, in summary, we are all immigrants, and the immigrant's journey is not as easy as you think it is. And the stigma towards immigrants affects every Canadian. Immigrants are the driving force of the Canadian economy, and nurses need to have knowledge and understanding of the immigrant's history and plight. And culturally competent care involves knowing the immigration policies and cultural knowledge. And nurses have a bigger role in breaking the stigma on immigration and in promoting health and awareness. Here are the references that I used for this presentation. If you have questions, please do so. You may email me at jj.bureau@yahoo.com. Thank you.